Evening. Thank you for attending the work session of the Lake Wales Charter School Board of Trustees. Marie, will you call the roll, please?
Trustee Marbuck.
Here.
Chair Hutto. Here. Vice Chair Blair.
Here.
Trustee Johnson.
Here.
Trustee McCann.
Here.
Trustee Stewart.
Here.
Trustee Winfrey.
Here.
Thank you. All right, and our first agenda item is update from Sean Arnold, our General Counsel.
Good afternoon, everybody. Congratulations on getting close to, if not to the end of another school year here. Just a couple of updates. All legislation related to charter schools this year stalled in the legislature, and it was largely a byproduct of the legislature's inability to complete its core work and move bills through the normal end of session process. So what that means to Lake Wales is a couple of different instances of where we were trying to get some legislative changes as it relates to conversion charter schools, and a couple of other items didn't pass. The entire charter movement was in this position, and it's been a long time since no charter bills have passed through the legislature. To that end, though, with the new leadership that's coming up is the new Speaker of the House is Sam Garrison, who I've worked with for several years when I was a young attorney at the state attorney's office, and I've known Sam for more than 20 years. I have a meeting set up with him, as well as Jim Horn, the lobbyist who's working with us, in June to go to his office in St. Johns County and go meet with him and talk with him about restarting that process and trying to get that going. So that's the biggest update that I have with you. I'm going to be working with Ms. Conrad and some other school administrators to do a little bit of a look at all of the policies that we have in place to make sure that everything is there. We've had several new schools open and a couple of new conversion charter schools which I've spoken to you about. We'll have 2 joining the family in August, 1 in Alachua County and 1 in Orange County. And to that end, we were standing up brand new school systems that look a lot like you. And to that process, we did work to kind of come up with a list of all the things that need to be there for a school to start up. And so I'll be sharing that work with the administration and other things like that. Otherwise, I don't have anything else to report, and I don't know if any of the trustees have any questions.
All right. Thank you, Mr. Arnold. We appreciate your update.
Thank you.
The next agenda item is paraprofessional calendar adjustment. So back in February, the Board of Trustees had approved a calendar for the 2026-2027 school year. Since that time, there has been some updates. You had the link in your board docs as well as in a board update that I sent out earlier. So in that update, we did move the teacher start date to August 3rd. That was the teacher first workday. But what we didn't do was move the paraprofessional start date back 1. And so with that, the paraeducator first workday will be Friday, August 7th. So thus the need to bring that to you for approval. Since we were bringing it to you for approval, we have also put up at the top professional development system days designated at the top. So September 4th, October 16th, January 15th, and February 12th. Those either align with early release days or they align with professional development record keeping day. That came directly from our professional development committee that has met all year. And so those were the dates that they wanted to have and transparent across the system. In addition to that, it is not highlighted down here, but with the change in some of the dates from the Florida DOE, we also updated the FTE survey dates and attendance window dates. so that all is accurate on this calendar. So I appreciate everybody who either sent information or worked on this calendar to help make sure that it is accurate and that it is posted to the website. Are there any questions? All right, thank you. And this will be before you for approval in our business meeting. And then I will turn it over to Mr. Smith for monthly financials and a budget amendment.
Thanks, Superintendent. Good afternoon, Board, Trustees. Before you, I have the April financial statements that I'll be requesting your approval. As usual, if we can just jump right into it, to the summary document, looking at page 1, going over the balance sheet, where our through the normal course of operations, or our assets actually decreased by $770,000 to $56.7 million. And basically, the change in that asset is really due to our cash within our capital fund, expenditures that's going out through capital fund, as well as through our health insurance as we move throughout the course of the period. Our system-wide liabilities actually decreased as well by $107,034 to $19.7 million in April. And again, our normal course of business, which is our payroll liabilities within the general fund, is where that decrease lies at. The position of the system continues to be pretty strong in terms of our cash flow and our ability to pay our bills. Moving on to page 4 through 13, where you go through the statement of operations. We've 91% complete for the year in terms of collecting our revenues. We have one more, which we're in the current period right now, one more month to collect revenues from the state or from FEFP. And we've collected so far through April $41.7 million in revenues, and our expenditures are lagging just a bit to $34.7 million. With our excess revenues right now is $7 million in terms of excess revenue. Please be mindful that the excess revenues does not include the month of June, which will have expenditures with no revenue. So when I present to you in the month of June, which will be next month, complete 100% of the revenues, and we'll still have May and June's expenditures to kind of finish out the year. And as I move forward, in fact, one trustee just mentioned to me if we could just go through an example, page 4, in that excess revenue line down at the bottom on page 4, you'll see where excess revenues are calculated. And this is a template that's actually used, that's presented by the Florida Department of Education, which is used throughout the state for all charters in terms of how they present their financials back to the state, so we have consistency throughout the state. If you look down at the bottom where it says excess revenues over expenditures, you'll see that the percentage, the way that it's calculated based on how we collect our revenues in advance and our expenditures are lagging at least 1 month. You'll see where our excess revenues are $7 million, where we expect our budgeted excess revenues to be $3.9 million. And that's as a result of us collecting that funding up front. We collect 11 payments instead of 12, and therefore we'll always have that until we get to the end of the year, and then it'll narrow down to whatever that percentage would be. Hopefully it'll be in the positive. If we've done a good job and been good stewards, it'll be in the positive, and it'll be a smaller number. Back to our summary document. There's no questions on that. I'm gonna give a pause for just a minute, just in case there are some questions on that. Okay, our supplemental programs, as usual, they all caught up to be in the positive for our pre-K programs. Everybody is actually doing well, in terms of finishing the year on a positive note. I believe that we'll continue that all throughout the year. It's always lagging in the beginning. You go back to the financials, you'll see plenty of months, where I indicated deficits through various programs. And as we get to the end of the year, you start to see the revenues catch up and the expenditures slow down quite a bit. It's the exact opposite of our general fund, where you start to see positive results at the end of the year, where programs finish the year with excess revenue or at least balancing. However, the pre-K after school program, It's always done well with Hillcrest and Babson Park, so they're moving along, posting their excess revenues. There's no questions on that. We'll move to the food service program, which has done very well, continues to do well. We will be having some additional spending on that probably roll into the July point where we have to spend down some of the revenues. We actually have a compliance issue that we've been dealing with related to too much revenue in food service. We have more than what we should keep. We're supposed to keep about 6 months of our normal activity. We probably got a couple years. So we have to kind of find compliance ways to address that in terms of spending those funding down. We're going to upgrade some things in our kitchens, upgrade some cafeteria things, and hopefully try to get within compliance on that. It is limited to food service activity, and I have a few ideas that I'm going to share with the superintendent in terms of how we'll kind of get that under control. Yes, sir.
Is there, I'm just asking, Mr. Arnold, if this is illegal, please let me know. But I mean, could any of this be used like towards like culinary programs or no? If that's,
No, sir.
Okay, just
No,
asking.
sir. Yeah, that's fine.
Didn't think so, but just had to ask.
You're right in line with the other board members throughout the state because they're pressing other CFOs to do the same thing. So
look at
you're
that.
not out of line.
Thank you.
Yeah, it's a situation where it's limited to certain types of activities, and we just happen to have a pretty large fund balance that we'll have to continue to try to spend it in the correct way. Moving on from food service to our federal programs, we're doing pretty good in terms of that at 70% of our budgeted funding at $3 million. Again, this is April, so it's lagging, so we hope to be somewhere in the 90% threshold and if not better, and have just a little bit of roll forward in terms of our entitlements. I believe we have all of the amendments in by now. Everything is in and kind of completed. They are completed, all of the amendments in, and we'll finish out the year spending in accordance to what we applied for. Moving on to transportation services, 2.2 million in spending, 82%, which is really good considering all of the increase in costs like fuel and other things that we've been kind of dealing with for most of the year. For us to actually be relatively close to in line with budget is really impressive. Transportation director, continue to commend him because he works really hard trying to make sure that we keep costs down but get our students arriving on time. So we'll continue to work through our challenges with transportation, but I appreciate us keeping the cost down, and I'm sure the schools do as well. Capital funding, our PICO is relatively the same. I check this number monthly to see if our revenues are in line with what we project them to be. They're still in line at Bach North receiving $496,000, $65, and Bach South receiving $425 respectively. That's to pay for debt service and other capital project activities. Any questions on the financials themselves? Trustee Margaret?
No, I don't have any. We've covered all my questions earlier, so we're all set.
Thanks, sir. No, I'm sorry.
Sorry. So, and I think we've talked about this just for clarification. The Babson Park numbers, that's just because enrollment's lower than we thought, our FTE?
Yes, sir.
Okay, so basically, it's not a spending problem, it's more of a revenue problem based
more
off
of a
what
revenue
projected to what the actual, okay.
And we try to do our best to adjust the revenues and adjust the spending, you know what I mean, as we get more information. It's a little bit hard with the way we're set up. Next year, we'll have much more of a fluid process to where we actually apply for amendments a lot more frequently, adjusting revenues, expenditures, working with the principals on program activities in order to meet the needs of the students. If there's no more questions on the financials, there's no personnel changes for this month. And that is the end of the financial report. Okay, moving on to a special item that I added to the presentation, which is the request, as I wrote a memo to the board requesting a budget amendment to complete the year. This is the best information at the best time that I have for both of these items. Starting with health insurance, obviously our claims that continues to come in. We do our best to try to anticipate what those are in the beginning of the year when we sign the notice. Obviously, when we see a spike in claims, I have to come back to the board and say, hey, I need more funding to kind of support the claims in terms of what we actually anticipated versus what we actually have. And right now, we're just requesting additional funding of $800,000 from the fund balance of the health insurance fund itself, not from the general fund, but from the reserves of the health insurance. And as indicated in my memo, my apologies. As indicated in the memo, it's 3.3 million as of 6/30/2025 in terms of the reserves in that point. Trustee Marbett had a very good question for me earlier this week, indicating how much should we have in the reserves, what's the requirement. It's 1 to 3 months in terms of what our average claims are. Our average claims is roughly about 465,000 when we have a normal year, obviously, and we've exceeded that point. Our claims have been around a little bit higher for this year, just a little bit higher, and it fluctuates. So we're running probably around 500,000 to 600,000 a year. 500,000 to 600,000 a month. So they're just elevated just a little bit. So we're requesting $800,000 to get us through the end of the year to ensure that I have the budget authority to continue to pay those claims. And so I'm requesting that. Any questions on that part? And now finish talking a little bit about health insurance in general after I get through the amendment part. Any questions on the health insurance request for that?
It's just to finish this school year?
That's just to finish this school year.
And I know you said, Mr. Marbett asked about reserves. You said it's what, 1 to 3 months?
1 to 3 months is what I've checked, as well as I've talked to our actuaries in terms of what is industry required. There's no law that requires us to carry a particular amount, but I've checked to make sure that we've had. When we started this, we were working with USI, our broker. They were very conservative and asked us to keep 6 months. So we were sitting at about $2.6 million when we estimated it would be about $450,000 a year, somewhere roughly in there. So we just we had more than that actually when we started, more than the 1 to 3 months. So
Okay,
right
so,
now,
so just for clarification, even if we approve this 800,000, we still have over $2.5 million in there?
We'll still have over 2.5.
So we'd still have more than-
we're still within our range, yes.
Okay, thank you.
If there's no question, I'll move on to the second part of the amendment, which is something that the board has already actually approved, which was the purchase of some capital equipment, which were the computers for Bach North and Bach South. It was $570,000. And so the request is $572,559, which all of that is related to just the authority to complete the purchase. The purchase has been completed, but I didn't get a budget approval to do it. I just got the approval to make the purchase. So I'll be requesting that as well to kind of complete the year. There's no additional revenues. We've already kind of went through in terms of how we're going to pay for this. It's been secured with a loan from South State Bank and all of the things. So that is something that the board has already kind of approved. Okay. So I'll be requesting approval for $800,000 for health insurance fund, as well as $572,559 for capital projects. To address, I guess, some concerns about our health insurance, if I may, board. We've been working really hard on this ever since it was identified back in, I want to say October of this year, that our claims was running a little bit higher. I did not sound the alarm because I was hoping and I would just use that term, I was hoping that that things would settle down, that these was, one-time claims that just kind of hit one month, and not having a trend. But we discovered that after looking closely at the data, that a lot of it was related to pharmaceuticals, and that some of our members were not actually getting any better, and that therefore that we would actually see these claims as we move forward. And so we looked at all sorts of ways, now that we're self-funded, all sorts of ways that we can make adjustments within our plan in order to, one, provide good service to our members, and two, for Lake Wales Charter Schools to survive it financially. As you know, that healthcare costs is something that is rising throughout the country. We don't have much control over it. And now that we're paying for our claims, other than the amounts over $200,000, which our stop loss actually covers, now that we're covering these claims, we get to actually see exactly what's happening, what the trends are, and so forth and so on. And so keeping all of our legacy structures, if I could borrow that terminology from the superintendent, keeping all of our legacy structures in mind, along with the changes in the activity and what's happening around us in the industry, we looked at a few things in order to make adjustments. The legacy structure was that we want to keep in is provide to our employees only free health care. But then it comes at what cost does it come? Obviously, if you look at our health care, it's probably, I won't say it's probably, it is the fastest growing expenditure that we have on the books by far. I'll go back to 2018 when I arrived in this position. We were paying $4.2 million. Today we're at 6.7 and it's climbing. So that's only 8 years ago, and you're already up more than 50% over that period of time, and it's continuing to climb. We don't have much control over that. So the question is, what do we do in order to keep some legacy structures in place, which is to provide healthcare, quality healthcare at no cost, as well as to not impact the budget to a point to where we can still, as a system, survive this over time. One of the approaches were to look at our pharmaceuticals. We looked at the pharmaceuticals. We looked at a plan. We had the Arnold firm look at a proposal with an organization. It came back where it wasn't for the Lake Wales Charter School systems. I'll say that. It was for other systems, but it wasn't from us. It had some questionable legal challenges within it, and at the advice of the attorney, we kind of moved away from that one. That particular proposal was estimated to save at least $1 million, but it wasn't something that fit our model in terms of our contractual agreement with Polk County Schools and other things. It was, like I said, questionable because it hadn't passed certain things. So we kicked that one, and we continued to work the problem. And as we were working the problem, we looked at our formularies in terms of our pharmacy program, what we're actually offering, because that is actually where our increase in cost is. Our pharmacy is up over what we've seen or what we presented, $1 million from the previous year. And that's really where the growth is in the pharmacy. And so we analyzed the pharmacy. We made some adjustments to the pharmacy that had the least amount of impact on our membership, but the greatest impact on the financials. Again, the least amount of impact on the membership because we have about 700 members that actually we're responsible for. And so we looked at that, and that is to kind of bring our costs within line about $600,000. That was not enough because as we looked around, we still, even with doing that, we still was looking at 10, 11 to 12% increase. We started at 19% if we did nothing in terms of the health insurance increase, and that obviously would in fact impact what happened in the classroom. If you look at, we're receiving revenues about 1% from the state, maybe 2% at the max, but this particular health insurance cost is 19%. I mean, we can all just kind of do the math and figure out it's not going to last long like that. So even at 19%, we make the adjustments with the pharmaceuticals. We got that down to somewhere around 10, 11%. That still wasn't sufficient in order for us to kind of make some adjustments. And then we had to start moving other levels. And one of the levels we actually moved was the deductible, where we actually increased our deductibles from $4,000 to, from our deductibles from $2,000 for our employees only to $4,000, and for family from from $4,000 to $8,000. My apology. And then the out of pocket is the same. We went from $5,000 to $8,000, and then from $10,000 to $16,000. These are not very favorable for those who are using it, but it is in line with systems our size and organizations within our area in terms of what employees are actually paying. And so some of the legacy structures we were able to keep in terms of we offering free health care to our employees only. But there's some legacy structures which in terms of matching our sponsor, we had to kind of remove away from, because we are in charge of and responsible for our own budget. And those were the levels that we actually moved on. Now, there are plenty of discussions coming into the 27-28 year where we'll be offering a lot more options for employees to participate. However, it will come a day where Lake Wales Charter Schools will not be able to carry the legacy structure of free health care in the manner that it has in 2024. There may be some free health care plan, but it won't look the way it's been looking in the past. And that's just to do, if we want to survive this organization, just where costs are in terms of where the claims are. I can't give you names, but I can give you data in terms of, like, we can run reports and you can actually see the data in terms of what the claims are. These are real claims, and we have to make sure that we can accommodate those. If not, either we're going to deplete the reserves of the health insurance fund, or we're going to have to curb some of the activities. And so that's where we are in terms of making the adjustments. It doesn't come easy. It's a lot of, if we pull this and push that and so forth and so on, how do we actually get to the best care at the lowest price for the overall organization?
I hear you, I do. And I'm very aware that there's 1,000 things I don't understand about healthcare. I do think that it's going to be very, very tricky for us as a system to draw quality educators when our sponsoring district already has, on average, half the monthly payment for dependents and half the deductible that we're going to. And then we're going to say down the road, not too far in the future, you're also going to pay for, like, it's going to be very, and we aren't getting cost of living raises as is. Like, percentage-wise, teachers make less now than we did last year or the year before. So, like, we do have to figure that out. Like, I get that we can't make dollars, but we got to figure something out, or we will lose quality teachers. They will go to the city next door and make more money and have cheaper insurance.
Well, I am aware that our sponsoring district is looking at a payer plan for all employees. And we looked at that option, but again, we was trying to keep with the legacy structure that Lake Wales Charter Schools offer health insurance just for this year, health insurance for free for employees only. But it's my understanding in the 26-27 budget that Polk County Schools will have a payer plan for all employees.
You mean as an option?
No, as this is the only plan, and everybody will participate and pay something on their plans. It won't be a free plan.
Okay, I don't think their teachers know that.
Well,
I mean, not my business, but.
so that's, I know it's in discussion. So we are mindful. We try to kind of keep up with what they're doing. Obviously, we have to negotiate our health insurance plan. We're on a different cycle. Mm-hmm. So we try to keep competitive with them. So right now, the model that we're rolling out is one that keeps with the legacy structure of a health insurance plan that's available. It's just that the deductibles, some of the nuances of what's happening is where we get to make the adjustments in the levers. If we weren't self-funded, right, and we were just going fully insured and we were handed a bill, here's your bill, $6 million, it would be the insurance company would make the adjustments for us. And and one of the things we won't be able to identify is how much profit is in there. There's zero profit. Obviously, if we get to a point in time, which we have in the past, not last year we were, the year before we weren't, to where we actually have savings, what we were able to do last year is hold no increases. There has not been an increase for family plans. We haven't had an increase, I don't know in how many years on that. We've been able to hold that, as well as the schools, in terms of employees only, haven't had an increase that hit their budgets. And so, in fact, I believe last year I actually cut it to where the schools actually paid less than they did the prior year because we actually had savings. So I understand what you're saying. Everybody around the state is making adjustments in terms of this. I can't speak to where we are in terms of compensation, but I do know that whatever's available to us in the TSIA will be made available to the teachers. There's no pre-negotiated amount like Polk County has, where I believe they've already decided no matter what they receive, they're providing 2%. We're going to provide exactly what the legislature produces. So that's, the best information I have now. Myself, LaQuanda, the other folks in the healthcare team that is sitting around, we're coming up with all of the creative ideas to offer, again, the best plans. I anticipate in the 27-28 budget that we'll have multiple plans, multiple options, and quite a few of them will probably come with some options to participate with a lower deductible. Obviously, it will cost them.
And I do know one thing we've talked about, at least in the Teacher Advisory Council, is better communication, better education. So like there are things available to our staff that some of them are just unaware of. And even things like this year, I learned more about budgets than I ever cared to learn. But one of the things I learned in dealing with teachers who were concerned is like maternity leaves. And because we don't have maternity leave, we don't have paid maternity leave, like short-term disability and things like that. So one of the things we need to think through is how to get information out to each school in a way that they hear the information.
Yeah, and I agree with what Ms. Winfrey just said, because I got an email from a teacher today with concerns over the $10,000 deductible on insurance. So is there an instance where their deductible would be $10,000 or?
The deductibles are going to be $4,000.
Maximum out of pocket is what she's talking about.
The maximum out of pocket, yes, they will exceed, they will go to 8 and 16 for family.
But I do agree with what Ms. Winfrey said, just making sure our employees understand the different options, that if there is an option to reduce a deductible at a higher cost, just to make sure that, especially if you're going to have those additional options next school year, that they fully understand each one. Because like at Warner, when we register for our insurance, we see a comparison. If you choose this option, this is your cost, this is your deductible, just to make sure that they fully understand which one is the best option for them and their family.
One of the, if I could just respond to that, Superintendent, before, we kind of looked at multiple plans, the multiple plan option. The multiple plan option, based on where we are right now, was going to push the deductible for the free plan much higher, because you're going to obviously have a pool of people that's going to go to the free plan. I don't want to pay anything, I'm healthy, so forth and so on. Then you're going to have a lower deductible option plan that's going to push to the other group, and that is going to be pretty expensive. If there's only a handful of folks that's actually driving that's going to go to that plan, then that plan is actually going to be really expensive. So we're still studying on it to pull all of the levers that we can in order to make those plans work. And it is a little bit more simple than just move a deductible here and there. It's also the population, because you at the end of the day, if it's $7 million in claims, it's still going to be $7 million in claims. The question is who pays what portion of it, right? And so if you have, 3 people, it's 5 people that drive 90% of the claims in most cases, or 33% of the claims actually. If those 5 people move to the high deductible plan and everybody else move to the free plan, then I mean, you still have $7 million in claims. You know, now those folks at that, they obviously can't cover the $1 million worth of activity in themselves, so the plan has to be reasonable. So it comes down to how many plans you have, what part of the population is moving within those plans, and then what's the offset for the system as a whole. And I believe, like I said, our sponsor district, from what I'm understanding, they're starting with a payer plan, and then they're gonna offer multiple plans, and all of them will be payer plans. It just depends on the risk level that those folks lie in order to get to the lower deductible plans.
That's helpful. I do have two questions. One is clarification. You said going from $8,000 to $16,000 maximum. I think it's going from 5 to 10. Is that right?
It's going from, it's out of pocket, from what I'm looking at on our rollout. The out of pocket is 8,000, and then for family it's 16, and it was 5,000 to 10. That's on the out of pocket. On the deductible side, it went from 2,000 to 4,000, and from 4,000 to 8,000 on the deductible side. And that should be in the open enrollment, and Ms. Burrows is here. She can also kind of provide some information if you guys would allow that in terms of communication. I believe she puts out a lot of newsletters and things like that, so we might need to kind of reiterate that, along with where people can go to kind of help us curb some of our costs, using teledoc and some of the other things that we use in lieu of using the emergency room.
One more thing. You've mentioned a couple times, we're looking into that, and I'm just curious, would it be possible for some teachers from each school to be on that team with you? For two reasons. I think it would just help disseminate information back to schools. Is that possible?
Yes, it can. There can be some folks from each school that represents each school. Yes, it can.
I would think that'd be actually helpful to you, because they would see firsthand what you see.
I would have to limit, yes, for certain discussions, I can bring a group together. I have to just be mindful of, when we start having conversations, be mindful of what the broker and the actuary are discussing, because sometimes we get more into diagnoses and things like that, which makes it a lot more complicated, because if, you know, we're a small community. If you know this person and so forth and so on. So sometimes that gets a little bit more complicated just to be able to do that. But I can have a preliminary discussion with an inside team, and then kind of strip it and then provide that to a group of folks.
At one point, we had talked about maybe having a clinic. Again, not understanding what the claims are, where all the money's going, but, you know, so, I don't know, let's just say that 60% of our claims were doctor visits, right? I mean, that's gotta be a lot of money.
Right.
If we hired a doctor, you know, is that a cost savings? I don't know the answer.
Yeah, before we went self-funded, we actually looked at a model that Polk County obviously have, and then a system that's similar to our size that Levy County had. It was a lot of upfront costs, and we kind of, we had other things that's happening in our school system, so we tabled it for a little bit. So what we've done is we've started to have conversations with other organizations to see if we have a group of activities or claims that we can actually move in that direction, to see if we can get discounts on that. So there's discussions about that as well, already established, instead of us kind of going and building a place or renting a place for that and hiring a doctor or nurses for that. We could actually, you know, see if we can work with an already existing organization around here to kind of mimic
Okay.
something.
So something like Advent Health, I think they'd be
Right.
very interested in that.
So we are in discussions with that as part of that, to kind of see if we can control or curb some of that.
I just want to go on that I don't know that there's anything we can do, but if there's anything we can do with those deductible numbers, man, that's a killer. So I don't know if we have to give up our pay on the board, I'd be willing to do that for the deductible.
What day?
So just a couple points being in healthcare every day. So even, since Mr. Blair brought it up, even Advent Healthcare, just back in the fall, had to start offering their employees, now they're self-insured, right? Because they're a healthcare system. They had to go to a multi-tiered system. And I will tell you, as a chiropractic physician, we've always been in network with that. They no longer, unless the employees that work for Advent choose to go with the absolute highest level, which most of them would have to pay $500 to $700 more every month, they lost their access to any doctor that did not work for Advent. So if you want to go to a dermatologist, they don't have one in Polk County that works for Advent. But we've got multiple dermatologists in town. There's not a single chiropractor that works in Advent. So, I mean, obviously it's it from my side, but you start going, hey, I need an endocrinologist, I need a specialist. Well, they don't have one in Polk County, you're going to Winter Park for that visit now. So a lot of them chose, hey, I'd rather keep $500 to $700 in my pocket, and I'll just choose to go see whoever I want to, and I'll pay cash. But I just want you to realize this isn't all of healthcare making more money. I just signed a new contract last week with Blue Cross Blue Shield that goes into effect August 1st. And they've cut our compensation again. I get paid half today for the same service I did 20 years ago when I got into practice. So this isn't me crying the blues for doctors that we don't get paid enough money, but talking about percentages, the costs are hospitals and pharmaceutical companies. Those are the ones that are making literally billions.
Yes.
Do we know, is there a certain class of drugs that is driving this up? I'm asking, is this like the GLP-1 inhibitors?
No,
or,
sir.
No.
No, sir.
Oh, she said yes.
We have,
Thank you.
I'm sorry. We have about 10 drugs that are very critical to our members, that are extremely expensive. And they're critical to our members in terms of, in order for them to survive, okay? And those are driving the cost. Now, we have some lower frequency drugs, as LaQuanda was talking about, that, you know, that we're moving to generics, or possibly even phasing out over a period of time. But let's go back for just a minute as we get to start to renegotiate this healthcare plan at the work session here. We try to lower the cost with the least amount of disruption. Okay, you just talked about a huge amount of disruption with the hospital itself in terms of what people are seeing. We're trying to do this with the least amount of disruption. And so, yes, the deductibles and things are high. The out-of-pockets are high. But it's with the least amount of disruption. Now, we could have done a ton of things in order to keep things lower, but it would have been a tremendous amount of disruption. At that point, we'd be having a different conversation about, rather, not necessarily deductibles. It would have been like, well, my doctor's out of network. I was just informed last week that my dentist that I've had for 8 years is no longer accepting our insurance. So now I have to go find a dentist, or she said, you're out of network. And I'm like, well, cancel that appointment until we figure out what that cost is. So I understand, you know, this is what's going to happen. And so every time that we make a decision, it's like, what kind of disruption? It's literally the conversation that we have, because I know that when you sign a new plan, when folks get ready to show up at their doctor, they realize, hey, my doctor doesn't support your program anymore. You have to go find a new doctor, and so forth and so on, especially if you have been seeing this physician for a while and they've been treating a particular illness for you. That's going to be uncomfortable. So we're trying to do this in the least disruptive way and survive this thing as well in terms of financially. And so, yes, there is a list of drugs where we changed the pharmaceutical. It's about 21 drugs that, in fact, less than 15, 20 people. They are not life-threatening. They are drugs that people can try in terms of the generic measure, and it's going to save us about $600,000. And hopefully that, with a few other changes that we made, we'll be able to kind of level off a little bit, and I won't be coming back to you next year for another $800,000 beyond budget.
The reason I mentioned certain classes of drugs is because these things become quite trendy, right? And so so that one class, the GLPs, like there's an old one called Biduron. It's generic now. It's cheap. But if you want the latest and greatest, right? Hey, I don't want semaglutide. I want tirzepatide. No, I want the coming out next year that's not going to cause me to lose muscle mass. You go from $15 a month to $1,200 a month.
Right.
right? Coumadin's $4 a month, Eliquis is $500 a month. So there's a huge difference, and if you talk to any physician in town, they know this, because if they take Medicare Advantage plans, the doctor's paying the bill, he's paying for the meds. So he knows, hey, this diabetic patient, I can put him on insulin that's $35 a month, and glimepiride that's $4 a month, or I can put him on this designer $1,200 a month drug. So there's a massive, massive difference. Not like, hey, it's twice as much, it's exponential, it's orders of magnitude different. So I don't know, I'm asking this question because I know these have existed in the past. Are there cases where we say, hey, look, we'll pay for this much of a generic drug, the system, but if you want to go with the latest and greatest, most expensive one, you're going to have a significantly higher copay for that one. I know that's not what people want, but you can't just walk. It's the same difference if somebody has a head cold. If you go to a primary care doctor, that's a $75 visit. If you go to a walk-in clinic, that's a $275 visit. If you go to the ER with a head cold, we just put a comma in that number, right? So we can do healthcare on a reasonable basis, and we can offer the same level of care. You're gonna get the same Z-Pack, but people that run to the ER and the walk-in clinic when they should have made an appointment with the primary care doctor, they just drive the cost of healthcare through the roof. So some of that, I think, is an education, like Ms. Winfrey was talking about, that we can educate our providers, go, hey, look, we want to keep these healthcare costs down, but you guys that want to go to the ER and get designer drugs every other week, you're going to drive this up. But this is a big part of healthcare costs today. So I just want to shed some light on that. Anyway.
Okay, so I think we just found something in the strategic plan that's significantly missing, which is implement, develop, or create or redesign our healthcare plan. And that needs to be underneath resources and finance. And we need to be having this discussion in different ways in different places, along with the Teacher Advisory Council, along with everybody else that's in here, our community, to talk about what is the best way to deliver this. But right there, I think we've identified something that was significantly missing right off our strategic plan. I also want to say is that we are currently in our open benefits or open enrollment window for benefits. And every single employee in Lake Wales Charter System has to open enroll this year. So to make sure that we have accurate information, you understand your elections, and that you're not just rolling from one year to the other, because within that, that's how you can get educated as far as like what you are choosing when it comes to your healthcare. So make sure, and we will send out many, many reminders, but every single charter school system employee has to open enroll this year.
Thank you, TJ, for that, and I welcome more conversations as we move throughout. We have a lot more levers that we can actually pull now that we're self-funded, that we can make adjustments to where we can provide the best care at the best price for every member. Again, when I start the conversation, I'm talking about the legacy structures and the least amount of disruption. That was really the primary goal, but as we move forward, you know, as TJ just mentioned, in order for us to survive this as an organization, all of us in this together, we'll have to make some adjustments and some changes. So.
Okay. Moving on, and the budget amendment will be in the business section of our meeting today, along with monthly financials. All right, moving on into the superintendent's report. If it is okay with the Board of Trustees, my actual update I will give in the business meeting, if that's okay. So then moving on to the draft strategic plan. So sent to you early this week was the draft of our strategic plan. It's also up on the screen for those that are joining us out on YouTube for our live streaming piece. And number one, I want to thank our community, the staff members, everybody who has given input for us to get to this point here, from town hall meetings to rounding meetings to staff meetings to teacher advisory council, to our principals, to our assistant principals, to our leadership across the system. Thank you, because this plan is directly coming from you and from our parents, from our families. So in the draft, really what you're looking at today is content and wanting your feedback in that content. In the draft, the first thing that you will see is the strategic plan commitments. And these commitments really reflect what has come from families, the community, staff, as far as what do we need to be aware of and what do we need to be addressing here in Lake Wales Charter Schools. So in those commitments, I briefly want to go over each one. Number one, over and over again, a systems approach. Shifting from a system of charter schools to a high-performing charter school system. That came out over and over again. Consistency. Establish and maintain standards of excellence in academics, operations, and culture across the charter school system. If there was one word that was stated over and over again in all of the different venues, places that I met people and we had talked to, consistency was it. Transparency in communication and actions. Foster trust through clear, proactive, honest communication and decision-making with all stakeholders. That was very clear and very clear with our Teacher Advisory Council. Address student behavior. Once again, then every single venue, any place that we got feedback, this was stated. And when we say address student behavior, this is what we mean. Implement comprehensive system-wide strategies to address and support positive student behavior and school climate. In other words, do we have systems in place? Do we have things set up to support that positive student behavior and the positive school climate? From the educator in the classroom to the school-wide, to in all the, whether it's the athletic field, whether it's the performance stage, wherever we are we performing, are we supporting positive student behavior and addressing it consistently? Empower educators and recognizing and investing in teacher effectiveness as the most critical school-based factor in driving student achievement. Are we supporting our educators? Because that is the factor, and that was very clear from our professional development committee this year, that they supported that as well. Acknowledge disparities in our community. Actively acknowledge and address community disparities to ensure every Lake Wales Charter School student has the resources and support needed to thrive. And that, do we have those mechanisms, do we have those systems in place to be able to do that across our system, from high school to VPK? Accountability through engagement, and this is a key word because I've also heard from community members, staff members, etc., that at times we are fearful or we are concerned about presenting our voice when it comes to critical issues, right? Things that we need to have courageous conversations about. And so accountability through engagement means cultivate a culture of shared responsibility by actively involving students, families, and staff in the decision-making process and maintaining transparent, data-driven reporting on our progress toward excellence. And also, I have a further definition of what that looks like in operations. So when you look at the commitments, I would ask the Board of Trustees, does this reflect things that you are hearing and what direction that we are going in Lake Wales Charter Schools?
Yeah, for me, I would say that I have had several conversations over the 3 years of being on the board that several of these items address. Some of them have not been brought up to me, but all the ones that have, these commitments address the ones that have been brought up to me over the last couple of years.
Yeah, and I would agree with Mr. Marbett, not just within our system, but these are issues statewide. So I think these would apply in any district, but especially the accountability through engagement, I think is the one that would probably mean the most, just because you are so actively seeking the voices of educators, people in the community with any decision that you're making.
So the next part of the strategic plan is all of the goals and the measures are divided under 4 pillars. So that's pretty easy to take a look at. There we go. On this next page, it talks about the goals and the measures of the strategic plan and how they're organized into levels of support. And so when you see those, you're going to notice that there are universal, core foundational goals that apply to everybody across the system. There are supportive or targeted goals and plans for student groups identified in school improvement plans and needs assessment, et cetera. And then there's also targeted goals that are very narrow and very specific to a group of students or an area within our charter system. And then as you get deeper into the strategic plan, you'll notice that there are a baseline and a target are indicated for each attainment goal. And an attainment goal is where you are trying to hit a number or you are looking to meet a certain target, if that makes sense. And that baseline and target is grayed out in the strategic plan for completion or process-oriented goals. And then there are timelines and measures for all the goals that are indicated, both types. But when you have a completion or process goal, it's really, it either got completed or it didn't get completed. So that's why the baseline and the target's grayed out. But more importantly is talking about that accountability through engagement and really the part about making sure that voices are heard and that we are striving for excellence. And accountability through engagement is a shift from top-down enforcement to a shared responsibility model. In other words, we're all responsible for excellence. High standards are maintained not just through policy, but through the active involvement and buy-in of all stakeholders, staff, students, parents, and the community. So when we talk about shared ownership, it's moving away from checking boxes toward a culture where everyone feels responsible for student outcomes, because that is number one. Our children being ready and prepared is number one, because they were involved in the process. Two-way feedback loops, ensuring that accountability is not just a report card, whether it be the school report card or the report card that a child is bringing home, but a continuous dialogue where the community can ask questions and the system provides transparent answers. Then relational trust, building the professional and community relationships necessary to hold one another to high standards without creating a culture of fear or compliance. And that's the key here. I've heard that over and over again, the piece of fear and compliance. And then visible progress, using engagement opportunities, town halls, surveys, committee meetings, our work sessions, our business meetings to demonstrate how the system is meeting its commitments to real time. And so feedback from the board, do you feel that hits the mark? Where are you positioned with that?
I think the most I hear from teachers, it hits the mark on relational trust and building. I think teachers feel like we're headed in a healthier direction on the whole. On the commitments, I think another concern is student behavior, and I've heard that at a teacher advisory council from every campus represented. I think that one of the effects, and maybe even still post-COVID, I don't know, it feels like there was a shift in student behavior on the whole. And so I think that's still probably the most taxing part of a teacher's job. So I think that's it's always going to be a big concern from K through 12th grade is behavior, and how we handle that as a system and what we will and will not tolerate. I think that makes teachers feel protected if there are some non-negotiables. So I would say trust in the board and primarily in our superintendent, and then student behavior, those are the things I hear the most about.
I think, I agree, I agree with exactly what Jamie said, but this accountability through engagement is important. I think let's just call it what it is, one of the things that having been married to a teacher for a long time, one of the most frustrating parts of a teacher's job as well, is trying to get parental involvement and those sorts of things. So I don't have the answer. I don't know how we do those things, but I do think that the things that you've outlined here, like transparency in our system, transparency in communication, all those sorts of things where they're out in the open, will go a long way towards helping that. And I know some schools struggle more than others with parental involvement. So I don't know what the answer is, but I think this is right on. Yeah. But you know me, I want it fixed today, but, right.
I agree with Trustee Blair that I like the intent of this. I think this is well focused. I think the parental involvement's huge. I think that's what separates the difference. I know it's not our role for the day-to-day operations, but as far as implementing this, I don't know. Have we looked at like some of like what Mississippi's doing, where they're saying, hey, you know, if you can't read by the time you're in third grade, then we're not going to let you proceed on because, yeah, I've heard somebody say one time, up until third grade, you're learning how to read. From third grade on, you're reading to learn, right? So if they're not reading well in third grade, pushing them on to fourth grade, fifth grade, we're just setting them up for failure. We're lowering our own test scores. Like all of these things start to fall apart. So I don't know if we have enough autonomy to do that as a charter school system with the sponsor district and all that, but maybe we sort of kind of set the path here in the state to do something like that. The other thing I think, maybe it shouldn't be in the strategic plan, but I think just the utilization of AI for teachers and for students, we need to be clear on what can and can't be utilized. Without getting into specifics, I think that's going to be a bigger and bigger problem we're going to have. I shouldn't say problem, it's just going to be something we have to be much more aware of moving forward. So.
And let me go back real quick to student behavior, because I agree with Jamie again that's probably the single biggest thing we could do for our teachers and for our kids. Let's just say you got 20 kids in a classroom and you've got one or two that are not there to learn or refuse to learn or refuse to abide by the rules, then all 20 suffer. And that's an issue. And that's an issue in our society, I think.
And I have a clarification, obviously not being a teacher, is that, are we talking about discipline? Because in the commitment, it says support positive student behavior. Are we talking about two different forms of student behavior in what we're addressing and what we're talking about? So I need a little clarification on that.
So if I can speak to that, behavior in itself is neither inherently positive or inherently negative. I think a lot of times when we say behavior, we're saying it as that it's negative, right? And behavior is actually a form of communication. And so how are we reading that behavior is really key in all of that. I think when parents, community members, families, et cetera, are talking about it, they're talking more about it from the lens of consistency in administering the student code of conduct, making sure that it's transparent in how things are done. It's all part, do you know what I'm saying? It's all part of the system. And at the same time, with a child, we were talking about a child like learning to read. We already have that system in the state of Florida, where at third grade, students need to be at a certain level, or they are retained and or have to go to summer school and have to demonstrate that they are proficient in third grade before being promoted to fourth grade. So that's already in play in the state of Florida, and we follow that here in Lake Wales Charter Schools. But just like that, when a child doesn't know how to read, we teach them how to read. When a child is exhibiting behaviors or not meeting the expectations in the classroom, we also have to have a system in place to be able to teach and to structure those behaviors. And at the same time, are we being consistent in like what we tolerate and what is actually excellence, right, when it comes to that? Because we have to balance between when does the right of one child interrupt the learning of all the other children within a classroom. So it's the balance between that, and that actually is in under safe and healthy schools, under strengthen our multi-tiered systems of support for behavior at each school site is where we start to to actually address those things within that. So did I answer your question, Trustee Marbut?
I guess our commitment is positive behavior, but
That-
in some of these, we're going to address negative behavior as well.
Yeah, what do we do when that when a child is demonstrating that,
Okay,
right?
and is Ms. Winfrey and all the teachers talking about negative behavior?
Yes, I think
Okay, that's fine.
undesirable behaviors, yes, are what hijack the learning process, yes.
Right.
I think
Okay.
most teachers are also very pro of positive behavior. I love
Yes.
for children who are behaving to be rewarded as well.
Correct.
So I can only speak for our school, but there's a regularly built-in reward for students who just do the right thing.
Right.
But there is a higher percentage of students who tend to hijack the learning process than ever before in education. And I think across our system, from K through 12, that trend is concerning. And we would love to be on the proactive side of let's right this ship.
Okay, and so we're addressing that in
Yes,
something.
you
inside.
got it.
Okay, that's
You
fine.
got it, you got it. So we are at 5:12, and I want to go deeper into this. And when the Board of Trustees was sent out a preparation document, you were asked 3 questions. As you review the draft, reflect on the following: strengths. What elements of the draft resonate most with you, and what are the key positives? Opportunities, what needs to be adjusted? Is there anything significant missing? And I just heard we had significantly missing health insurance plan, or a redesign of our health insurance plan will be added on to resources and finance. So I heard that. And then questions, what questions or wonderings do you have regarding the draft? And so I'll open the floor to any of the strengths, opportunities, or questions.
I do have a wondering, especially for really all schools, and looking at a baseline versus the target. It's great, and I feel like you should have a target you're aiming for. A little concerned about some things that feel like they're outside of our area of control that impact especially our more vulnerable student populations. For example, at student attendance. I can't teach a child who's not present. I can't make the parent bring them. So I would love for some thought to go into that when it's not, every school doesn't have that same challenge. And so I think it's important for us to spend some time trying our best to mitigate that hurdle that teachers have no control over when we're discussing their grades.
Is it also fair to say that those absenteeism, or chronic, what's it called, chronic absenteeism, also may be the same students that are behavioral problems?
Sometimes, but some behavior problems are there every day.
Okay. Yeah, and I know everybody's heard me say that, but attendance and discipline are my 2 big things, so thank you for bringing that up.
And both of them are addressed in those percentages. And there are absolutely ways that through engaging our families, engaging our community, that we can hit those targets of having a 96% attendance rate, addressing chronic absenteeism, because when children aren't present for instruction, that's really, do you know what I'm saying, that's really hard. So keep in mind that underneath each of these goals and measures and targets is going to have to be like an additional planning and work at the school level and at the system level when it comes to being able to hit that target. And when you see those numbers there, that is like taking a number, and that is systems wide. That doesn't reflect the number for one school versus another school. We're looking at this as at the systems level, if that makes sense. Other things that resonate, opportunities or wonderings in the strategic plan? Anything missing?
I kind of have a question, and we addressed it in the enrollment policy and things of that nature. But as far as getting Lake Wales students here, I don't know if it should be more so a part of the strategic plan, but I do think it should definitely be a priority in making sure that we are educating our Lake Wales students. And that was a big part of it. That's a lot of what I hear in the community, is there's concern of Lake Wales students coming to Lake Wales. As well as you guys have already hit on the transparency and the I guess you called it the disparities in the community and things of that nature. So.
I'm just going back to the parent involvement. I'm not sure how we would do this, but just going back to like what Ms. Stewart just said, just acknowledging the disparities in our community. I've been to an event at one school, standing room only, a similar event at another school where there were a handful of parents. And I'm not sure how we do that, even with behavior and attendance, just recognizing the population of one school isn't the same as another, and just how, as a board in the district, how can we support the schools in those areas that are the biggest need for them and their population, but there's not an easy answer there.
No, there's not an easy answer, and it's got to be a differentiated answer, right? Using education speak, we got to be making sure that it's customized strategies for our families, and in particular for the individual schools. What one parent or family event that works at one school may not draw the same engagement at a different school, and it's really got to be dependent on that school's charter and their culture and climate.
So this is a great discussion because you never know what you might have a question about, or you might read it one way and it might be interpreted incorrectly by a non-educator like myself. I think this is it's a lot of work went into this. I just highlighted some of the things that I was happy to see in here that I've heard either through the community or through meeting with the schools. Obviously, number one, which is academics, is focusing on achieving a high-performing designation for the charter school system. Obviously, that should always be our goal, but, that was one thing. The other thing I highlighted was the attendance issue as we met with each school and attended the attendance meeting. And, determining, just like what we've talked about here, is that you can't make the parents sometimes bring the kid to school, and you can't punish the kid for the parent not bringing them, especially in an elementary school. But yet attendance clearly affects scores and grades for each individual student. If you're not here, you can't be taught. So I'm glad that that's a big focus as well. From the community standpoint, the development early childhood community partnership plan to ensure all children are school kindergarten ready. You hear that from the chamber, and attracting, good companies to come here to hire our, graduates from Lake Wales High School. So I'm glad we were focusing on that. And then on the financial side, obviously working on our partnership with Polk County School Board with our buildings and all the financial challenges as we found out with the health insurance, funding from the state. There's a lot of state mandates that go out that get unfunded, but yeah, we have to suck them up, and there's only so many dollars to go around. Some difficult topics to have to talk about with employees as we move forward with funding and pay and everything like that, because obviously we've got to make sure the system is healthy from financial to continue doing what we started 20 years ago. So that's my couple of takes on that.
On page 5, and as he was talking, this just came to mind. The first item we have, the federal index, all schools at 41% or above for students with disabilities, and growth trend. Is there a reason we didn't do the other subgroups? as part of the strategic plan?
So the other subgroups absolutely need to be addressed, but this is underneath targeted. And this is the area that if we are going to really push high performance, our target groups on all of our school report cards are heavily populated with ESE students. And so with this is what is the area that we really need to be paying attention to?
Okay.
And it's our ESE students or students with disabilities. So currently we have 2 schools, so when you look at the baseline, it's 2. 2 of our schools are currently at that. We need all 7. We want all 7 to be at that piece. But when we're looking at that target, it's, we are going to serve all students, but it's really where is that area that we're going to get the biggest leverage.
So the other subgroups would still be in their school improvement plans?
Oh, 100%. They have to be.
That makes sense. Thank you.
Why the 41%? That seems like just a random number, if I'm just asking.
Yeah,
Is that like a
it's-
state standard?
That's federal.
Oh,
So
okay.
that is,
Thank you.
that is the standard, so. So any other closing thoughts? We're at 5:21 and I want to make sure that we get to our Board of Trustee discussion. So the next steps is that this plan, and I will add in the redevelop or redesign of our healthcare plan also as a goal or a target. This will go out to our entire charter system employees for like do you know what I'm saying, a feedback, and they would be able on Google Form to give feedback to any of these pieces, so. And then on June 22nd is our board retreat all day, along with a business meeting afterwards. And with that, we will be structuring our board retreat around the strategic plan. And also would be asking for your approval at the business meeting on June 22nd. Okay. Right, so with that, I'm going to turn it over to the Board of Trustees report. Dr. Hutto?
I'm going to leave my chair report to the business meeting. But at our last meeting, our next teacher rep is coming from Babson Park. And at our last meeting, they weren't ready to name who that representative was going to be, but it's going to be Mr. Bill Pierstorff. And then next we have the renaming of the 1919 building. So I'm going to turn that over to you, Mr. Flair.
So I sent some information out very early about this. And so here's the thing. This was, the naming of that building was on the City Commission's agenda for June 17th, 2003. That the city staff recommended it on June 13th. That actually, that motion came up. It passed on June 17th to name the 1919 high school building, the Mimi Reed Hardman Hall. It passed, all A's, no nays. And I don't know what happened to that. The bottom line on this building is she went and procured the building. She got a lot of grants to, here's something I found interesting in reading the history of this. Those windows in that building were redone in the early 2000s, which is hilarious to me, because that was almost our biggest cost of, and the doors of redoing that building. I just feel like that she also was responsible for getting the Kirkland Gym, got that deeded to the city. And there's been a lot of things. She founded the Lake Wales Historical Society and was president of that. I just think it's time that we have an opportunity here to make something right. Not only is right, but I think it's the beautiful thing to do, because if it wasn't for her, we wouldn't have that building. And so I'm just going to suggest that we name that in honor of that building, in honor of her. Not talking about changing the name of Bach North, anything like that. Just that we name that building in honor of Mimi Reed Hardman, and that's something that we remember all the work that she did here for all the years that she was here. So I don't want to belabor that conversation. Does anybody have any questions, concerns?
I do. So obviously the city voted on this in 2003 and never did it.
Right.
It wasn't very important to them that they continued to go through with what they did. Secondly, I talked with Ed Locke from Simco Construction, and he actually went with Mimi to the state capitol to procure funding. And several times we were voted no, and Mimi and Ed got us money when we were vetoed, and then got put back on and got some funding for that. So her ability to keep that building. However, when we got that building, what state of repair was that building in?
Yeah.
The charter school system raised the funds, spent the money, and built it into the building it is today. So it wasn't Mimi, it wasn't the city. Had we not had that building, it would have cost us a whole lot more to put that building on there. So, you know, I have a picture of Mimi and my son at Pioneer Day. She asked me to have my son do the Pledge of Allegiance when he was Cub Scouts. So I'm very supportive of Mimi and everything. I just don't know if we just want to automatically just make this decision without some discussion. Do we have any other buildings that are named after anybody on any of the campuses?
I don't know, do we have any other buildings that people procured that they gave to us?
Well, we didn't get it to them, we bought it.
Yeah, we bought it from the city.
Now,
Well, the city
forgave it, but we did pay for some of it. So it wasn't given to us initially. So that's number one. Number two, do we have any, TJ mentioned it took board approval, not foundation approval, to name different things. Have we got any classrooms or anything that's named after anybody
Yeah,
in the
so,
system?
sure, yeah, so there was, when I was on the foundation board, we had sort of kind of set dollar value figures that if anybody had donated $1 million, that we would name the building after them. If they donated $500,000, that we would name the auditorium after them. At $250,000, you would get the media center, and then at the $100,000 mark, we would name a classroom after them. We had 5 or 6 of the $100,000 donors. I want to say we had 6. 2 of them were anonymous, didn't want their names on them. But there's 4 classrooms that have a plaque. They have a nice bronze plaque over the classroom door. So Tommy and Lynn Oakley, Sam Peterson, Houston's, for all the cars that they've donated that we were able to raffle off, and the Yana Foundation are the 4 that have names on classrooms as of right now. But there's no names via the foundation that were assigned to either the auditorium, the media center, the 3 remaining classrooms, or the building.
So I have a question. So this city commission, where they voted the naming of the 1919 building to be named for, on behalf of Miss Mimi, when we bought it, does this, yeah, I mean, is this because, was it supposed to be named after her with the city owning the building? But then when we took over, now this is no longer, this is like void, so,
I think we just started calling it the 19. I don't know that any of us knew.
yeah, I
that
didn't, so
I
this is
didn't
all
either,
new to me,
right.
so.
So I guess they named it that building. When we bought it, Ricky may be able to provide something. We just started calling it the 1919 building because we didn't know what else to call it.
Okay.
that
And
fair?
1919 is what, when it was first built or something?
Correct.
Oh,
Yeah,
okay.
and if you read the rest of the documents in there, they had 2 performance halls. So the city manager suggested they name one the Mimi Reed Hardman Hall to differentiate, so we wouldn't call them,
The same thing.
we're talking about 2 performance halls. So really, that was initially how it came about, and then just to honor Mimi Hardman, which I think, you know, her name should be honored in this city. I'm not against that, don't get me wrong. But I just don't, you know, we're setting precedent here of something the city did that they didn't follow through with. We own it now. We put our money into it through donations and charter school funds and built the building out. So, you know, I don't know if I'm 100% behind naming the whole building after Mimi. maybe we name the Performance Hall
Yeah.
after Mimi or something like that as a suggestion.
Yeah, so along those lines, I mean, I think to answer your question, Ms. Johnson, I look at it like if you buy a boat, right? I could buy a boat from Mr. Blair, and if he named it, Real Time, and I want to name it Hot Doggin' or whatever, I mean, whatever the name is for the boat, you can rename a boat when you take it over, right? You can rename a dog when you buy somebody's dog. They might not respond to you. But in this regard, yeah, I feel like the city went through the paperwork. I don't feel like they did anything with it. I have all the love in the world. I mean, Miss Hardman's husband delivered me as a baby, right? So, I mean, yeah, we go way back.
You wouldn't be here
Without her husband. Probably still be here. No, but I mean, but with that said, I have no strong conviction one way or the other. I think it would be a great honor to Miss Hardman, but I can also appreciate Brian's point of we're sort of kind of setting a precedent of naming a building after someone. The one thing she did procure that we did benefit from was his red chairs. So that was something she had secured a lot of money. Alan Walters was a general contractor who did a lot of that work 25 years ago and put the windows and the doors in and the framing and a lot of the stuff, some of which we used, most of which we didn't because it had not been well kept. Like to your point of that, it was in very bad disrepair. But those chairs were kept at City Hall for a quarter of a century, and we were able to utilize them. And for those of you guys that weren't there, when Reed Hardman walked in, he didn't know that, and he saw those chairs, and he said, my mom picked those out. Like, he knew instantly from looking at them, that was my mom's style. So, yeah, I don't have strong convictions one way or the other. It's at the board's approval.
My recommendation would be that we definitely do something in honor of Ms. Hartman. But I also agree with, if we're gonna name, there's so many people that donate, and they donate lots of money for their names to be on a building. So I would be in approval of that being something different, but definitely paying homage to Ms. Hartman in some way, shape, or
Yeah,
form.
and maybe it's okay. Maybe it's just this, we dedicate this building in honor of
And not the
Mimi
name on
Reed
the
Hartman.
building.
Yeah, and we put a plaque there. This building is dedicated to the memory of Mimi Reed Hartman.
Yeah.
I think that accomplishes what I would like to accomplish, and that's just something to say, hey, thank you for all you did for our city.
For me, the city's decision has no influence on my feelings, but if I'm standing outside the 1919 building, I don't think of Miss Hardman. But you can't walk into the auditorium without seeing her touch. I mean, her own son saw it. Yeah. So for me, I like having the 1919 building, just the history of Lake Wells, and then the auditorium itself being Mimi Hardman Hall. Because, I mean, I just feel her presence walking in to the auditorium, so that's my thoughts. How are you with that, Mr. Blair?
I think that's okay. I mean, because 90% of that building is the hall, right?
Yeah.
Is that fair to say? Is it 90%?
No,
Not 90.
it's not. There's 6 classrooms upstairs. There's a whole nother level.
Right.
A media center, and there's a downstairs with principal's offices and secretary's offices, a band room. So no, I maybe half, but I wouldn't say 90%.
At least half, yeah. I mean, I'm not directly opposed to that. I just go back to the fact that, for me, it was, she went and procured that building. That's, we can say whatever we want to. That building would have probably been knocked down if it hadn't been for her. So we would have spent more money.
But to Mr. Marvin's point, she didn't procure it for us. If she had, I'd be 100% on board.
Right.
100% on board. And I'm not saying I'm not on board, but I mean, he makes a strong point. She procured it as a performing arts center, which
Right.
is not what we utilize it as, right? And it wasn't like it was handed over to us by Mimi and, hey, here you go. Like, we put multiple millions of dollars into that. And there was a lot of other people who did donate an awful lot of money
Yeah.
who weren't honored in that way.
Yep.
So if we're trying to set a precedence of a hierarchy of who donated what and what level of recognition do you get, I think Ms. Johnson's recommendation of maybe naming the hall after her, because it does. I mean, it screams, if you knew Mimi Hardman, it screams her name. I think that's a great honor, a great way to remember her, memorialize her. So.
If I may, we are currently at 5:35, And if it is the will of the board, I would like to take a 5-minute break, and we will start our business meeting at 5:40 and include any other reports in the business meeting. Are we amenable to that? All right, thank you. We are adjourned for the work session, and we will start our business meeting at 5:40 PM. Thank you.
This meeting to order. So Mr. Andy Blair is going to lead us in the invocation and pledge of allegiance.
All right, let's pray. Father, we thank you so much for this day and, Lord, for another opportunity to serve you and to serve the students of this community and our teachers and administrators. Lord, I just ask you to give us wisdom and discernment as we make decisions here. And we thank you again for today. It's in Jesus' name I pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Marie, can you do a roll call for us?
Trustee Marbut,
Present.
Trustee Hutto,
Present.
Trustee Blair,
Present.
Trustee Johnson,
Present.
Trustee McKeon,
Present.
Trustee Stewart,
Here.
Trustee Winfrey.
Here.
Madam Chair.
Thank you, Marie. Are there any scheduled persons addressing the board on agenda items?
No, ma'am.
Okay, the first item we have is the calendar adjustment for paraprofessionals. So I'll entertain a motion for that.
So moved.
Moved by Mr. Blair. Is there a second? Second by Mr. McKeon. Any discussion? Okay, Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair.
Okay, motion passes. Next, we have the renaming of the 1919 building. So I'll entertain a motion.
I'll make a motion that we rename the auditorium in the 1919 building after Mimi Reed Hardman, in honor of Mimi Reed Hardman.
Is there a second?
I second.
Second by Dr. Johnson. Any further discussion?
Yes, I thought there were two ideas that I liked out of that. One is the motion on the floor. Second was Andy Blair's comment about a plaque that we would dedicate the building in memory, but it wouldn't be named after Mimi. So I didn't know if anybody wanted to consider that option, or are we just good with the hall? I'm good either way, but I just know that we had discussed that. We didn't really get too far along with the plaque point of it, so.
Would you say that that plaque would be for the entire building, or the plaque, instead of naming the auditorium, do the plaque for the auditorium? Or either one?
I think what he said, I think what I brought up was we put a plaque on the outside that we dedicate this building to the memory of Mimi Reed Hardman.
And I think it goes back to the original conversation that we had. Does the building represent Mimi, or does the auditorium and what her goal was for the building originally being performance related? Am I correct in that? That maybe it would be better suited that if we did the in honor of, that we do it for the auditorium instead of the actual entire building.
Yeah, the motion we have on the floor is to name the auditorium the Mimi Hardman Auditorium.
Yeah, I like that idea. I think the other one is kind of,
Which one?
the auditorium, naming that after Mimi. Because you can put a plaque in the auditorium and, kind of go that route.
Any further discussion?
I guess we would have to.
So the motion on the floor is to name the auditorium the Mimi Reed Hardman Auditorium.
I think you have to back out of the motion or something.
No, the motion on the floor is to name the auditorium the Mimi Reed Hardman Auditorium. That was Dr. McKeon's initial motion. So that's the one that we're voting on.
All right, can I amend your motion? You made the motion, right?
You told me to make a motion, yeah?
No,
Go ahead.
I'd like to amend the motion that we put a plaque. right there that says, we could do it outside the building or right inside the building, either way, that we put a plaque there that memorializes what that this is her auditorium or whatever we're calling it. She had
I'm
it
okay
set
with
for
the plaque.
performance hall.
Yeah, that could be included in my amendment, that's fine, I have no problem with the plaque.
Okay.
Okay, we need to vote on the amended motion.
Can we restate the?
Yeah. What's your amendment? Make it clear?
Yes, let's make that clear.
My amendment is, okay, so here's the amended motion maybe, is that we name the auditorium, is that what we call it?
Yes, sir.
Okay, we'll just name it the auditorium, the Mimi Reed Hardman Auditorium, but we place a plaque, we can decide where, that memorializes that as this is in dedication to and named for, I don't care what the wording is, Mimi Reed Hardman.
I'm confused.
Huh?
So Mr. Blair's amendment is
that we add a plaque.
to take, yes.
That's
to
what's
take
the amendment.
Dr. McKeon's motion with the addition of having a plaque
Yeah,
within the auditorium.
what she said.
Doesn't
It
change,
doesn't really.
doesn't change anything.
Okay, can we discuss?
Yes, sure.
Okay, so correct me if I'm wrong. We're going to name it the Mimi Hardman and put a plaque in honor of Mimi Hardman? Why would we do both? Maybe I'm confused.
We're gonna name the auditorium, and we're gonna put a plaque up memorializing
To honor
that.
her.
Just the same, it's the same thing, we're just putting a plaque up.
Oh, okay.
We didn't really need the amendment.
Right.
I'm okay with the plaque. It can be a
Okay.
disc, it can be square, round, bronze, whatever he wants it made out of. I'm fine with that.
Probably should be red.
You can
Ms.
pick it out,
Conrad?
Andy.
I think where we are right now is that there is an amendment on the floor that was first or moved and seconded. And so we need to vote, yes, there will be a plaque, or no, there will not. So that's first. And then after that is done, then we can, then go back to the original motion and of renaming the auditorium for Mimi Reed Hardman.
Marie, you want to do a roll call for the amendment?
Yes, ma'am. Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair,
So now we need to vote on the motion to name the auditorium the Mimi Hardman Auditorium with the presence of a plaque. Is there any further discussion on the motion? Okay, Ms. Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Motion carries. Next, we have approval of the Board of Trustees work session minutes from April 20th. I'll entertain a motion.
So moved.
Moved by Mr. Blair. Is there a second?
Second.
Second by Dr. Johnson. Any discussion? Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam
Motion-
Chair,
Motion carries. Then approval of the Board of Trustees meeting minutes from April 20th. I'll
So
entertain a
moved.
motion. Motion by Marbut. Is there a second?
Second.
Second. Mr. McKeon, any discussion? Okay, Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair,
Motion carries. So next, we have approval of the financial report for April 2026. Is there a motion?
So moved.
Motion by Dr. McKeon. Is there a second?
Second.
Second by Ms. Stewart. Any discussion? Or any other questions? Okay, Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair,
Okay, motion carries. And then approval of the budget, approval of the budget amendment. Is there a motion?
So moved.
Moved by Mr. Marbut,
Second.
second by Dr. McKeon. Is there any further discussion or questions? Okay, Ms. Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair,
Okay, motion carries. Ms. Conrad, back to you for the superintendent's report.
Thank you, Dr. Hutto. In your folder, as well as it will be posted on our newly launched last week's staff portal page, are all the superintendent's reports for the year, and this one will be published there as well. So since our last board meeting, I've been present, visible, and of service to our schools and community. So first off, the rest of April and all of May, I feel like it has been budget and planning season for sure. And so as you can see in there, our principals and our leadership of Lake Wales Charter System has been actively working on and planning through our strategic framework that was also inside of the draft of the strategic plan of integrating funding and planning. So really shifting the way that we are thinking about how we resource and support our school improvement plans and the needs of each of our schools, and very much leveraging our grants and our federal dollars, making sure that we are not leaving a dollar on the table or a penny on the table. So with that, you can see that there have been a series of budget meetings with schools and departments, and this morning, we worked on department level or system level budget, just as we did with the schools. I have attended the ESE team trainings and really focusing in on and honing in on how we have our in-class service delivery models, and we are working on specifically designed instructions, being able to attend volunteer events, also working with our principals and our educators on looking at an ELA curriculum called Benchmark Advance, and we're getting closer to making a selection and making sure that we have an anchor ELA resource for the schools that are looking for that. And making sure that our teachers have that comprehensive anchor resource. Teacher Advisory Council met with Trustee Scott Thompson to get to know him and prepare for his signing in or swearing in on June 22nd. And then meeting once again with elementary principal meetings, and then it's academic and award season for sure. Dr. Hutto, I think I see you everywhere that I go when it comes to academics, awards, and banquets. Then also planning meetings around our PD committee and getting ready to really take a look at the roadmap to mastery, focusing in on standards of math and reading ELA at all levels, and focusing in on that in our strategic plan. Professional Development Committee, Lake Wales Public Library Partnerships, ESOL planning, and then I attended all three Lake Wales FFA chapter banquets. So, and my husband got to attend along with me, so he learned a lot about FFA as well. Doing student services interview, looking at drafts and reviewing that of the strategic plan. And then this has been a lot of this month. I think it's this time of year, but parent and family problem solving and support meetings at the charter office for I think every single school. We've had some type of support, staff problem solving and support, and then multiple visits to school, because this is the time of year to really celebrate all the accomplishments of our students and our educators. But one thing that I would like to announce through community engagement is our Volunteers of the Year. Little did we know that we actually did Volunteers of the Year. So our volunteers play an invaluable role in the success of our students, our schools, and the entire Lake Wales Charter System. Thank you for your exceptional dedication and for everything you do. Many of the schools have already held volunteer receptions, but I just wanted to publicly say the recipients. So for Dale R. Fair Babson Park, we have Deborah Hernandez. For Jeannie Howard Wilson, we have Rafael Anzueta. Hillcrest Elementary, Ashley David. Polk Avenue Elementary, Tammy Carter. Edward W. Bach Academy North, Candy McKeon and Lisa McClellan. Edward W. Bach Academy South, Ruthie Moyer, I hope I said that correctly. And then Lake Wales High School would be Tanisha Schrader. So congratulations to them and thank you for all you do. And one last thing to conclude my report is now that the Board of Trustees has seen the first draft of the strategic plan, I will be sending that out systems-wide with a link to gather additional feedback on like in a Google form format to help us refine each of those things and also give individuals an opportunity to read through that. And you will hear more, and we'll be looking for approval of the strategic plan at our June 22nd business meeting. And that would conclude my report, other than Monday, June 22nd. In the library will be our board retreat right here at Lake Wales Senior High School, as well as the business meeting would then take place in the auditorium. We would not be live streaming on YouTube for many hours, the board retreat. So the business meeting will be streamed. Anybody is welcome. It is an open meeting. And lastly, as a reminder, baccalaureate is this Wednesday for our graduating senior class. And then also graduation is on Friday, and looking forward to that for our class of 2026. And that concludes my report. Dr. Hutto.
Thank you. Marie, are there any scheduled persons addressing the board on non-agenda items?
No, ma'am.
Thank you. So next we have approval of board seat number 1. This is the teacher representative from Del R. Fair, Babson Park Elementary, and that will be Mr. Bill Piersdorf. So I'll entertain a motion for approval.
So moved.
Moved by Dr. McKeon, second by Mr. Blair. Any discussion or questions? Okay, Ms. Marie?
Trustee Marbut,
Yes.
Trustee Hutto,
Yes.
Trustee Blair,
Yes.
Trustee Johnson,
Yes.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair.
Thank you. Motion carries. Trustees' reports. Ms. Winfrey, do you have anything to share?
Just, we had our final Teacher Advisory Council meeting of the year on May 4th. Notes of that were sent to each campus. It did generate a lot of conversation about health insurance. So thank you, Mr. Smith, for answering some of those questions. I would just really encourage y'all to consider putting a insurance committee together that includes teachers from each school. And I think that would be great.
I think it would be too with the representation from the board.
Right, we do have a doctor on the board,
Yep.
and we have, schools, teachers that have great insight. That'd be a great committee.
I agree. So move.
Wasn't a
Second.
I know.
You're an attorney.
I know.
Yeah, Ms. Stewart, do you have anything?
I did want to, I guess, bring up, we had talked about way back when, a scholarship committee, and I know I didn't kind of bring this up with Kim in a while. If we can try to get that back on track for our schools, and I don't know if that's a foundation question as well, more so getting a committee from the board. However, I think that would be a good thing for our schools.
Marie, can we put that on the agenda for June?
They have one. The foundation has a committee. They do.
Dr. McKeon, do you have anything?
Same thing I tell my kids. You guys press on 2 more weeks. You're almost there. Cross that finish line. Thank you guys for everything you do. Thank you for the banquets and the award ceremonies I've been to and I get to go to. And hope you guys just don't lose your spirit as far as educators go. Thank you.
Dr. Johnson?
Yes, I just want to give a shout out to me being able to attend along with Dr. Hutto, the Tropicana speech contest over at Janie Howard Wilson. I don't know if Kim has left the building, but oh, hi, Kim. So it was amazing to hear the students. They were excellent, and they were great. They were absolutely great. And I enjoyed being there and being a part of that and seeing them, the ones that, it's always hard to pick winners out of kids, right? But, somebody has to, win. But it was a great opportunity. I also had the opportunity to attend the last SAC meeting as well, hearing about all the great things that Kim and her team over there have been doing. I'm sure each and every other school have been doing the same thing. So just continue with, I'm going to echo what TJ said, just keep on keeping on. I know it's tough, but keep on keeping on. And so thank y'all for everything that you do. It doesn't go unnoticed, so.
Mr. Blair?
I had the opportunity to do the Tropicana speech contest at Polk Avenue, so I appreciate that opportunity. It was a great morning. It's a lot of fun.
Yeah,
And
the topics.
to watch the student, oh yeah, they get to pick whatever topic they want, and some of them work so hard. It was a lot of fun. So I appreciate opportunities like that. So other than that, I think I just want to say that again. I think this has been a good year. We've been pretty drama free. And so I think we've been able to focus on what we need to focus on. And so for that, I'm very thankful. So thanks to all the teachers and our administrators as well.
Mr. Marbut?
Yes, so I had the same sentiment, and I'll talk a little bit more about that my last meeting, which will be the next meeting. But just very encouraged by the staff and administration and the board and community support for the charter school system and educating our children. So kudos to everybody that's involved in that process. It's been eye-opening for me. We did have an audit committee meeting earlier this month, and we had our first audit for our new company that we went with, Purvis & Gray. And so as in all audits, there's a few findings. I asked Mr. Smith to kind of give me the top 3 that he had, and then a timeline to address those. Some of those will be addressed as we convert to a new system. Some will be addressed this coming school year. Some will be addressed in maybe the following school year, kind of similar to our healthcare insurance situation. However, we will have that report for everybody next month, so I'll talk a little bit more about that. But I just have one quick question to ask Mr. Smith, just for everybody's kind of information and knowledge to have, and just kind of what his take has been with the new company and the communication with the new company and the timeliness of the new company compared to what we had previously.
Well, the new firm has been great. They came in last year to review our entire system, not only just our accounting, but our IT, just the way we're structured and operate. They've identified some opportunities for us, to improve on. And the communication it's just been very transparent and open. Very good group to work with. They're back. We had our interim review recently. They're excited as well. Much smoother process the second time around. Obviously, they know more about us. We know more about what to expect from them and the timing. So everything's been really good with the new firm.
Good. All right. That's all I have. Thank you.
I just want to reiterate what others have said and just thank our principals and our teachers for an amazing school year. Just lots going on with celebrations and honor society inductions and just the hands-on learning. The fact that here at the high school we have to split awards into 3 nights because of the sheer number is phenomenal. As Dr. Johnson said, she and I did the Tropicana speech contest at Janie Howard. I did one at another local school, and while those students did amazing as well, Dr. Johnson will tell you, a couple of the Janie Howard students had us in tears just with their vulnerability and just the personal nature of their speeches, and it was just truly phenomenal. I also want to shout out Miss Havens and Miss Regal at Del R. Fair Babson Park. They just had a talent show and an art show. I wasn't able to attend this year, but I saw pictures and videos, and they just always just do such an amazing job with the students there. Polk Avenue, I've continue to serve on their SAC committee. And at Polk Avenue, they actually have student representatives from 3rd, 4th, and 5th grade. And just being able to hear that student perspective has been awesome. Bach North did their dinner with the night, and I don't know if the rest of the trustees did that, but it was absolutely amazing. Our culinary programs at the middle school as well as the high school just do a phenomenal job. So having a cook-off might be something we need in the future, Mr. Saran. I've been to Bach South's FFA banquet, and if you've never gone to an FFA banquet, I'd highly recommend it. Just listening to the students is amazing. Our athletic teams continue to do phenomenally. Baseball, I believe, we're district champions. Softball's regional champions. Tennis went to regionals for the first time in multiple years. The FFA Ag sales team from the high school were also state champions. The weightlifting team represented well at the state. I want to shout out the ESOL teacher here at Lake Wells High School, Dr. Marisol Peltzer. Her students ranked first in the entire nation on the exam that goes with their curriculum. Did I say that correctly, Mr. Saran? Okay. But they were first in the nation, so that's just truly phenomenal. At our Career and Technical Education Awards, over 150, I believe was the number.
I believe it was more like 160.
Okay.
Yeah.
But
It was a lot.
we have
It
a
was
lot of
impressive.
students graduating with industry certifications.
Yes.
One young man talked about how he's using his to pay his way through med school, and just our career academies are just doing phenomenally. So it's just been an awesome year. So thank you to our principals for their leadership, and just our teachers for the hard work, and hang in there. You're almost there at the finish line. Is there any other business for the good of the cause?
I'm sorry, did you talk about the softball team?
Yes, I said
Okay.
they're regional champs.
Yeah, they're headed to the Final Four this week, so.
Yeah, they're awesome. Any other business? Okay, I will entertain a motion to adjourn.
So moved.
Dr.
Second.
McKeon, second by Mr. Marvitt. Marie?
Trustee Marbut,
Yes.
Trustee Huddle,
Yes.
Trustee Blair,
Absolutely.
Trustee Johnson,
Definitely.
Trustee McKeon,
Yes.
Trustee Stewart.
Yes.
Madam Chair.
Motion adjourned, or meeting adjourned, sorry.
Meeting adjourned.
Thank you.
Thank you, everybody.